Coming up, we'll be on location at the Julian Center for Comprehensive Dentistry in Columbia, Maryland, discussing the latest advances in sleep apnea treatment and how they can effectively treat sleep apnea without the use of cumbersome equipment, prevent the associated risks and dangers that help you get a good night's sleep that you desire with one of this region's top dentists, Dr. Sambataro.
I did the sleep test, and sure enough, I had pretty significant, high, moderate to almost severe obstructive sleep apnea, and didn't realize it, thinking that my lack of sleep was really just kind of the way it had to be, and it really doesn't have to be that way, and I feel awesome.
Our dentist had sent me for a consult for Tyler for his underbite, and I was originally told by that doctor that I should have him in braces. It seemed a little early to me, so we came to Dr. Sam for a second opinion, and he said, no, we don't need to do braces. I've got just the right thing for you. So we went with this mouth guard, and I've been very pleased. The results that we've seen in 3.5 months that he's been wearing it have been very impressive.
If you have a problem, this is the man you want to go see.
Dr. Sam received his DDS degree from the University of Maryland School of Dentistry and is widely recognized as one of this region's leading dentists. Welcome, Dr. Sam. It's a pleasure having you on our program.
Yeah, thank you for having me here.
It's your first time, in fact, with us, and we have a lot to talk about regarding a very big issue out there, which is the sleep apnea disorder and how it's very dangerous, and we wanted to have you on to educate all of us about it and what options are available to help people who suffer from sleep apnea. Plus, we're going to be hearing from a patient of yours a bit later, Tyler, and his mom. But I wanted to begin, if I may, Dr. Sam, by having you please tell us what sleep apnea is.
Well, that's an easy thing to do. By definition, if I take those two words, sleep, so it's what's occurring when you're supposed to be sleeping. Most people actually are sleeping. They just don't realize that what's going on during that time. And the word apnea means to stop breathing. So they're not getting breath, they're not getting oxygen during that most critical time during the night when you're supposed to be sleeping.
Yes, that's a very dangerous combination,
yes,
right? We're supposed to be not only resting when we sleep, but we're supposed to be breathing when we sleep.
Yes, yes.
So sleep apnea is when we're not breathing.
We're not breathing, or we stop breathing, or there's disrupted sleep breathing. Snoring even is a part of that. So basically what's happening during that restful period of time is that we're not getting enough oxygen to all the cells in our body, including our brain and our heart. So this is critical to the time when our body should be recuperating and healing and restoring itself.
Yes, indeed. And now, how do you determine, Dr. Sam, if a patient is suffering from the sleep apnea disorder?
Well, interesting enough, I mean, there are tests, and we'll talk a little bit about those, but it's generally the spouse is telling us that their spouse is, or their partner is snoring, or I'm watching them stop breathing, and I'm a little bit concerned that they're not going to take another breath. So that's kind of the first thing. The second thing is daytime fatigue or sleepiness. So falling asleep at work, falling asleep while they're driving, those are pretty good indicators that they're probably not getting restful sleep. Now, there could be other reasons. I have children, I have pets, I have, whatever it may be, but more than likely, it's because they're not breathing properly.
Now, what would you say in addition to those one or two symptoms that you mentioned? Are there additional symptoms that we should watch out for?
Well, those are the most common.
Okay.
Some of the others are a little more subtle that they may not correlate with. Maybe a history of hypertension, cardiovascular issues, potential stroke, depression even, erectile dysfunction. And these things all can be cofactors or comorbidities associated with that, which if you've been diagnosed with diabetes, you're probably not thinking that this is a sleep disordered breathing issue. Or if you're obese, for example. So not sleeping, not getting enough oxygen actually changes the hormones in our brain and can affect the way we eat, and that can affect us putting on additional weight.
I appreciate you telling us that. Now, how common is this problem? Because we know a lot of folks, unfortunately, do suffer from sleep apnea.
Well, I think it's much more common than what the statistics say. They say it's about 35% of the population. tended to be more men than women. But as we expand this field, we're finding that it's not just sleep apnea. There's also something called upper airway resistance, which is more common in younger, healthier females. So typically when we think of sleep apnea, we think of overweight men, snoring, waking up or rattling the house. And that's typically true, especially you see this even in athletes, especially football players who have very large necks. So it's very common.
Yes, in fact, speaking of football players, several years ago, a Hall of Fame football player from the Packers, Reggie White, unfortunately died
Yes, he did.
because of sleep apnea.
Yeah. And there's other people like Judge Scalia that who actually had a CPAP machine, which we'll talk a little bit about here in terms of the solutions, next to his bed. So, so it's a very, very important thing and issue. And if you're looking at some of these health consequences, and we just talked about stroke, cardiovascular disease, diabetes, hypertension, what's the underlying cause? So it's not a deficiency in a particular drug or pharmaceutical. You know, so if we get to the underlying issue, and I talk about this in my book, Stop the Snore, we haven't seen a decrease in cardiovascular disease, even though the Surgeon General said smoking is unhealthy. And since that time, people exercise more. I think they eat better, you know, than they did before. But the number one killer still is cardiovascular disease. So is it related, and we'll talk about what causes those issues, but is it related to a sleep disorder breathing or sleep apnea or upper airway resistance?
Yes, indeed. Now, I know you've touched on some of the risk associated with sleep apnea, but I just wanted to ask you if it goes untreated, like in many cases it does with people until they realize they have the sleep apnea disorder, are there any additional associated risks that the person is looking at?
Well, we talked about some of the health comorbidities that in many cases does not have a underlying cause, at least not from the medical perspective.
Yes.
So I think it gets no more basic than we have to breathe. We must have oxygen.
That's
so
right.
When you look at, for example, what they call the 3 pillars of health, which is nutrition, exercise, and sleep. So I kind of shift that around and say, actually, the foundation is sleep, of which the other 2 pillars are built on. Because you can exercise all you want and you can eat the best food. And if you're not sleeping, you're not getting oxygen, most of that's not going to make a lot of difference. So we don't even know all the potential consequences of this not sleeping. Besides, you know, the comorbidities, what about daytime sleepiness while you're driving? Look at the number of accidents that occur that are responsible because someone fell asleep. And not just on the highways from people driving, but industrial accidents, Chernobyl, 3 Mile Island. All these accidents occurred after 12 o'clock at night. More likely, sleep deprived. Some of the accidents have occurred on, you know, the train or railway system, bus systems. This is a very serious thing. So now you're not only causing major industrial accidents, but you're also involving a lot of other people that may be at risk. And so I would urge all our listeners, drive defensively.
Yes.
And if you are sleepy and you're falling asleep, please pull over. You're not going to get there any faster.
Absolutely, except the big difference is you'll make it there alive.
You'll make it there alive.
That's right.
So, and I think probably everyone is listening, including myself, have tried to push that envelope. Yes. I'm 5 minutes from home. I know I can make it. I'm falling asleep.
That's right.
So this is, you know, wake up, pull over, take a little rest. When I say wake up, I mean wake up to the information.
That's right.
Because we just are, I think, too dangerous out on the highways. And so there are as many accidents related to sleep deprivation as there are alcohol. The key is, though, many times that's not reported.
That's true.
You know, because there isn't really a law against driving when you're sleepy or drowsy, right?
Yes.
But there is against drinking and driving. Yes. And also think about when most people are drinking and driving, usually late at night, right? They're at a party, it's very social, there's a lot of activity, and then all of a sudden you get into a car, it's dark, it's warm, okay, you start to fall asleep while you're driving. Very, 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 very dangerous.
Yes.
So in addition to not just your own health issues, we are now bringing in other people's lives that we have to be aware of.
Yes, and those are some great points, Dr. Sam, and you're absolutely right. It's really, I would say, understated the problem,
Yes.
even though that 35% figure you mentioned earlier of the population here in America that has sleep apnea or suffers from it is really understated as far as the damage it potentially is doing
Yeah.
if you factor in some of those examples that you
Yeah.
just mentioned,
Yeah,
where it's
so-
not counted, right?
Yeah.
As a reason for that
So people's
happening.
lives, the cost. I mean, you think about even productivity at a
That's right.
workplace.
That's right.
You know, how many employers would love to have their employees awake for the entire
That's right.
day of their
If you add
production?
all that up, you're probably looking into the many billions or trillions of dollars lost in productivity
Yeah.
if you add it all up in the workforce.
Yeah, so they're falling asleep, they're calling in sick, maybe they're, because what happens that when you ask other risk things, your immune system takes a hit when you don't sleep.
Yeah.
And I think everyone can relate to that. If you had
Yeah.
a poor night's sleep, you just
Yeah.
feel like, you know, like I have a cold, I feel groggy, I
Exactly.
just don't feel well. So
That's right.
And now your system is more prone to the people around you who may be coughing or sneezing. So now you're going to catch something much easier. So
That's right.
So the studies are there that our white blood cells actually decrease when we have a poor night's sleep.
And it makes us more susceptible, like you said, to
Yeah.
these other problems,
Yeah.
instead of having our immune systems at full strength.
Yeah. So I think it really, from a health perspective, it covers almost every aspect of our health.
Yes, it does.
So, including what occurs during our sleep periods, we go through several cycles. One of those cycles is called deep sleep.
Okay.
Deep sleep is when our body restores. So if you have chronic pain and you're not getting deep sleep, you're not going to recover. So if you have brain fog, if you have memory issues,
Yes.
so that's all consolidated during REM sleep.
Yes.
Rapid eye movements, that occurs later in the evening or later in the night while you're sleeping. If that's not occurring, you're going to have brain fog. You're going to feel groggy during the day. You're going to feel like your memory is lapsing. So all these things are occurring during a very important time of the night, which I used to take for granted.
Yes,
You
I
know.
think many of us did.
Yeah, well, you went to college, you know.
Yes.
I'm sure you didn't go to bed at 9:30.
No, not at all.
Yeah, and that sort of carries on as you go into business. You know, you tend to stay up late, and you're also the era when, you know, at 12 o'clock the TV went off.
Yes.
That doesn't happen anymore.
That's
so you
right.
can watch TV 24/7. People
right.
are on their iPads, they're on their cell phones. So people are not taking sleep serious. And I know from my perspective, it used to be a badge of honor. Oh, I can survive on 3, 4, 5
That's
hours.
right.
Oh, and if you weren't a real true warrior.
That's right. That's you go out with your friends, and then, or you do something or the other with, to kept you up a lot later than maybe you should have been up. And next thing you know, it's like, yeah, I had 4 hours. Oh, I only had 3 last night. It's like, like you said, like a badge of honor.
Yeah.
When it's not that at all.
But
we
you
need
know,
the
when
sleep.
you asked about sleep apnea, of course, someone who goes to bed at a regular time, sleeps throughout the night, maybe they're getting 8, 9, 10 hours, and they still feel tired.
Yes.
That's the people who have either insomnia, sleep apnea, upper airway resistance, or what we now call sleep disordered breathing. So,
Now, what is your approach, Dr. Sam, to diagnosing patients for sleep apnea?
well, the gold standard is something called a sleep study,
Okay.
and there's basically two ways to do that. You go to a sleep center where they're going to hook you up with lots of wires. You're going to have a technician there that's going to follow you throughout the night and film you and record you, and you're in a strange bed. So it's sometimes very difficult. It does give you more information, or what's come more recently is what's called a home sleep study. So in the
Okay.
privacy of your home, in your own bed, we can record what's happening while you're sleeping. How many times you stop breathing? Are you snoring? Are you clenching your teeth? What's your oxygen level? So your oxygen level should be in a 98% to 100%. We see oxygen levels drop down into the 70 percentile.
Oh my God.
We see people stop breathing for as much as 25, 45 seconds at a time, and may stop breathing as many as 30 or 40 times per hour at a minimum of 10 seconds. This is
And
a
we have-
serious issue.
And we have no idea it's happening because we're asleep.
You're asleep, and there's also an amnesic effect. So we don't remember. So it's up to our partner. And I have patients who live alone and have no idea. I had a young man who had no idea until he went away with a family trip, and they said, "Oh my God, listen to this recording. You were snoring, sawing logs all night." He had no idea. So we suggested he do a sleep center, and he came back with a score, and I'll just kind of define that. The score was called AHI, apnea hypopnea index. So it's
Okay.
measuring what your oxygen levels are and how many times you stop breathing.
Sure.
A score of 5 and below is normal.
Okay.
5 to 15 is mild. 15 to 30 is moderate, and above 30 is severe. His score was 85.
Oh my goodness.
85, and he had no idea.
Mm.
Yeah.
And that means that's how dangerous it was
Yes.
for him.
So he's on the brink of potentially having a heart attack or a stroke.
Yes.
So it's not just the long-term chronic issue, is that someone can die in their sleep.
Yes.
So it can be a very acute issue. If it's not acute, then you have to deal with these chronic issues. But people are, as we said, they have all these medical issues, and we're dealing with pharmaceuticals, and that's not necessarily the answer.
Yes, indeed. Now, Dr. Sam, who would you say, and I know you've touched on this a bit earlier, but who would you say is a typical candidate for the treatment option to help people with sleep apnea?
Yes, for sleep apnea, the typical candidate is a middle-aged, overweight man or either large neck who tends to snore a lot. Okay, so they're very disturbing to the family. That's your typical patient. Unfortunately, they don't know they have that problem. And I know I've been away on many weekends with, in a large facility sleeping with other men, and I tell you what, it's like 9 out of 10 of the men are snoring.
Yeah, many of us do. You're
Yes.
right.
And I'm not a snorer, but guess who's not sleeping?
That's right.
Same with the spouse. In fact,
Yes.
they found that this is a cause of a lot of marriages being split up. And at minimum, 35% of marriages or couples sleep in separate rooms because of the snoring.
My goodness.
And they've even done a recent study where it showed that there's auditory damage to the sleep partner because of snoring. The decibels of the snoring is so loud.
Yeah, because we've all been in that house, right? Where the snoring is so loud by that individual that you can hear it 2 levels up sometimes.
It's like shaking
Even
the
with
house.
the TV on.
Yeah, exactly.
That's right.
So that's your typical. But there are these other issues which I talk about, something called upper airway resistance.
Okay.
That tends to be a younger female, actually looks very healthy, would never suspect that they have a breathing issue.
Okay.
And children, which we're gonna talk about Tyler in a second, why he was presented here more as a preventive thing.
Okay.
So children have what's called sleep disordered breathing. So they tend to have snoring, mouth breathing. They may be bedwetters. They may be irritable. They may have poor performance at school. So there's a lot of issues that are occurring with children. And that's what got me really passionate, is like, I'm treating these adults.
Yes.
What if we got an opportunity to treat these patients when they're children?
That's right.
So we can prevent the sleep apnea.
What a great thing you just said there, because you're absolutely right. We associate sleep apnea generally with adults, but
Right.
by utilizing preventative methods, right?
Yes.
On kids, we can many of them, as a result, can avoid having that horrible problem later in life.
Yes, and we can treat them with appliances that will help their sleep, help their breathing, but there's a great side benefit. What's happening and why it's causing this problem is that our jaws are not growing and developing as our ancestors did. A couple of reasons for that. One, not breastfeeding.
Okay.
2, the introduction of these soft, gooey foods into these little packets.
Yes.
We need children and infants to chew hard foods. So and I say hard foods, I mean things like broccoli, things that require chewing. These things stimulate the growth and development of the jaws. With the growth and development of the jaws, the tongue is in the right position instead of the back of the throat. So not only are we improving their airway and all these other childhood illnesses like ADD, ADHD, is also we're preventing the need for orthodontics.
Yes,
So
that's
not
right.
needing braces, not needing teeth extracted. So all we're doing is we're stimulating what's in their genetic makeup already.
Yes.
So look at the increase from when we were children. How many had braces? Not that many. Now every kid has braces. What's going on? No one's really addressing that. So
Right.
as I started treating the adults with sleep apnea, I said, maybe we can actually prevent children from ever developing and becoming sleep apnea patients.
Yes.
And I said the side benefit, no braces, no extractions, a more fully developed jaw, better profiles, and really overall going to be a healthier patient.
Yes, indeed, and have a healthier life as a result without all those associated problems and risks.
Yeah, because guess what? Unhealthy children
Yes.
become unhealthy adults.
That's right.
So they take these ADD and ADHD children and put them on medication.
Absolutely.
It's
No,
not the best result for those children.
you're right. No, another great point, Dr. Sam. And on that note, I wanted to also ask you, how do you determine the appropriate level of treatment that may be necessary for each of your patients when it comes to sleep apnea?
Well, we're going to first, do a questionnaire.
Okay.
Probably, and also a questionnaire with the spouse, because sometimes we don't get the truth from the patient. Sometimes they're dragged in here, especially if we're talking about men, because they're in total denial. So, and the wife will bring them in and say, look, you're snoring, you're disturbing me, I'm not sleeping,
Yes.
I'm concerned about you, I watch you at night, I don't know whether you're going to take the next breath. So we already know there's a clue there. So we'll fill out a questionnaire, and then we'll do an examination. So there are dental factors that are very important to look at. 1, do they have jaw issues? 2, are their jaws narrow to the point where it looks like their tongue is too big for their mouth? So guess what happens when you have a narrow jaw? The tongue has no place to go. So where does it go? Back of the throat.
Yeah.
You lay down at nighttime, and that tongue is actually blocking the airway. And it's actually partial blockage is what causes snoring. Full blockage is what gets us to stop breathing. So we're looking at that. We're looking at, do they grind their teeth? Are their teeth worn down? We look at how their teeth come together. We look in the back of the throat. Can we actually see their airway? We should be able to see their airway. And probably one of the most important advancements is what's now called a CBCT, is a cone beam 3-dimensional X-ray, where we can look at the patient's airway. That's a very good clue. But the gold standard still, with all that information, and maybe we believe they have an airway issue, we're pretty confirmed that they do. We're pretty confident.
Yes.
They have to do a sleep study.
Okay.
So, but there are some fallacies to the sleep study. And I'll tell you, if it comes back and it says they don't have sleep apnea, they might have upper airway resistance, which won't show up.
Okay.
2, and this is a good example for our audience. If you have a sleep study and it comes back less than 5, which I spoke as the normal,
Okay.
1 apneic event means you stop breathing for 10 seconds or more. If you stop breathing for 8 or 9 seconds, 100 times in one night,
Yeah.
your score is 0.
Oh my.
So it's not totally accurate. So is someone who stops breathing 8 or 9 seconds
Yes.
at as much risk as someone who stops breathing 10 or 11 seconds or more? I believe so.
Yes.
So, but it's not scored. So then we go back to, so what are the symptoms? Daytime sleepiness, snoring, restlessness, maybe even for men and women, getting up to urinate throughout the night. Okay? Another misinformation. It's not always men's prostate. It's not always women's bladder. When we aren't breathing, it throws us into this sympathetic fight or flight state.
Okay.
So we've all probably experienced or heard, I was scared so badly I almost peed my pants.
Yes.
Right? So what happens when you're in a fight or flight state? You're not getting enough oxygen. The adrenaline starts pumping, the cortisol starts pumping, and guess what? Your bladder releases. So you wake up maybe during that apneic event and you feel like, I got to go to the bathroom.
That's right.
So we all think it's because our prostate's enlarged. A lot of it is related to sleep apnea. So again, misinformation. So what's going to happen? Maybe we're going to treat the woman for urinary incontinence. We're going to treat the man for prostate enlargement. Well, maybe it's really sleep disordered breathing.
That's right.
Now,
That's right. No, those are great points because, again, it goes right back to what you said earlier in the interview, and that is that sleep apnea is really being undiagnosed or misdiagnosed in many cases, even though they're putting about 30 or 35% of the country with sleep apnea disorders, because it's affecting us in so many other ways that are related to that sleep deprivation problem.
for my consideration is that everyone should be evaluated for this.
Yes,
You
it's
know,
absolutely.
What is the harm in evaluating what's happening during that very important time when we should be resting, we should be restoring our bodies, we should be refreshing our memories? Wouldn't it be good information to know what's happening during that time? And especially if you have a particular diagnosed medical condition,
Yes.
like we talked about, diabetes or cardiovascular issues, why shouldn't it be that the first thing that we check?
Yes.
Let's make sure you're sleeping. Let's make sure you're breathing. Let's see what your oxygen levels are. If those are okay, then we can move on to other things.
Now, what are some of the treatment options for sleep apnea, Dr. Sam?
That's a great question because this is very important to the audience. The gold standard in the medical community is a CPAP machine.
Okay.
Okay? It stands for continuous positive airway pressure. We've all seen these masks. Now, I have to say, they have gotten better. They've gotten more conservative. They're smaller. But
Sure.
most people picture this sort of Darth Vader mask. It fits over your face.
That's right.
And it's very disarming to the spouse in terms of having to deal with this. But it's also an inconvenience for the patient themselves. What if they're traveling? They have to travel with this. They have to clean it. They got to make sure it's clean because it can carry a lot of bacteria.
That's right.
And we've got studies now that show long-term use of the CPAP machine. What it does, it puts pressure on the face. So a few minutes ago, we talked about the underdevelopment of the jaws. So pushing and putting pressure on the upper jaw actually can make the condition over long term worse.
Oh.
Okay? So yes, it's life-saving, and I'm certainly not here to downplay it because it is a very important thing, and people will experience an amazing first night's sleep with their first CPAP. But then slowly they start to say, I don't want to wear this thing, it's inconvenient, I got to travel with it. So it's not something I'm making up because the statistics say that only 30% of the people who actually get a CPAP machine will wear it on a regular basis.
So not many are using it after time.
Yeah, so there's lots of reasons. From my perspective is that long-term use could cause more issues.
Okay.
The next standard is what's called a mandibular advancement appliance. So something that you put in your mouth and you bring your jaw forward. Bringing your jaw forward brings the tongue forward. So holding the tongue out of the back of the throat. So most important if you're someone who's a back sleeper, because unfortunately almost everyone snores when they're on their back.
Yes.
Okay? And everyone's gotten that elbow from their partner.
That's right.
Like turn over. So if you have sleep apnea, I would say, and it's not treated, the best thing you can do, sleep on your side.
Okay.
Okay? So these appliances hold the jaw forward, which then holds the tongue out of the airway, and that can help them breathe.
And that's something we also wear at night when we're sleeping?
Only at night.
Only at night.
Yeah.
Okay.
Okay? Now, there could also be nasal obstruction. So if someone has nasal obstruction due to environmental toxins or food allergies where you can't breathe through your nose and requiring you to breathe through your mouth, that's a very inefficient way to breathe. We're not dehumidifying the air. We're not filtering the air from microbes. So we can end up with dry throat, inflammation, even tonsillar enlargement.
Yes.
And we're not getting something that's extremely important when we breathe through our nose, and that's called nitric oxide. Nitric oxide is something that our body produces basically to dilate the blood vessels. So as an example that someone can relate to, Viagra is a nitric oxide stimulator. So it helps bring blood to a certain area of the body.
Yes, that's right.
But it's very important for our blood system and our cardiovascular and circulatory system to get this nitric oxide. So sometimes we got to deal with getting someone off of mouth breathing and getting them breathe through their nose.
Okay.
So even though they have a CPAP machine or they have a mandibular advancement appliance, if they're not breathing through their nose, it's still going to be inefficient.
All right.
So the third issue is let's get them breathing through their nose, not making them a mouth breather, and let's treat the underlying issue, which we've already mentioned a couple of times. Let's expand the arches. So with orthodontic or orthopedic appliances, and because there's a genetic predisposition to have larger jaws,
Yes.
we can still stimulate that. And we've shown that in studies up to the age of 92 years old that we can actually expand the arches, make them wider. So here's the advantage to that, is that once that's done, you're done. You don't then have to wear a CPAP machine, and you don't have to wear a mandibular advancement appliance. So we've addressed the airway by expanding and making room for the tongue, teaching people to breathe through their nose instead of their mouth, proper position of the tongue on the roof of the mouth.
Yes.
So what's the real advantage? They're breathing better all day long.
And they're breathing better, like you said, all day long moving forward because now the problem has been corrected.
Yes. So we're getting to the root cause.
It's not a Band-Aid, it's actually correcting the actual problem.
And if you watch like the Olympic racers, the ones who finish first, watch, their lips are together, and you see the people behind, they're
That's
breathing
right.
through their mouth. The winners are always nasal breathers.
That's an interesting point,
Yeah.
something I have to watch for next
Yeah.
time.
So we talked about at sleep, you go to that fight or flight state.
Yes.
It's a sympathetic adrenaline rush. When we breathe through our mouth, that's sympathetic. When we breathe through our nose, parasympathetic. Calm, rest, and digest.
We're now going to meet a patient of Dr. Sam.
A number of years ago, as I started going into menopause, I started snoring and just thought that's what people did as they got older. And it started becoming more of a problem at home. I've been married for a long time, over 30 years, and my husband was really struggling with my snoring because it was keeping him up. And so I mentioned that to Dr. Sam, and he asked if I'd ever done a sleep study or been tested for sleep apnea or obstructive sleep apnea. And I did the sleep test, and sure enough, I had pretty significant, a high, moderate to almost severe obstructive sleep apnea, and didn't realize it. So Dr. Sam started treatment with an appliance, an expansion appliance, which honestly I had never really heard of. I had a number of friends who had been diagnosed with obstructive sleep apnea, and they had those monstrosity CPAP machines on, and I did not want to mess with that. In fact, one of my brothers had been diagnosed with obstructive sleep apnea and was on a CPAP he probably wore it for about a year and then stopped wearing it. Unfortunately, a few years later, he suffered a major stroke, a debilitating stroke, and he's still alive, but he is on disability now permanently. After that happened, I took obstructive sleep apnea very seriously. Dr. Sam put me in an appliance and told me it would probably be 12 to 18 months of wearing it if I was compliant. Compliance is a huge issue, and I was really compliant. I was very motivated to not have to wear a CPAP machine. I really cannot communicate how awesome I feel by sleeping better. I just feel like for years, whether it was kids, young babies, turning into kids and not sleeping when they're not sleeping, to then, the later years as they went into their teenage years, I started going into menopause, thinking that my lack of sleep was really just kind of the way it had to be, and it really doesn't have to be that way, and I feel awesome. The Julian Center and its staff and team are close to my heart. They are so loving and caring, and they really do care about their patients. Honestly, it can be from just the way they're speaking to you to sometimes someone putting a hand on your shoulder just to let you know that it's going to be okay when you're in the chair. And I initially had some other work done by Dr. Sambataro. I had some amalgams removed. I had 5 amalgams that had to be removed, and that was a pretty lengthy process. Ultimately ended up with some implants and things like that. So this team is really nothing beyond spectacular and very caring. I have shouted his name from the rooftops and mountains of where I've traveled. Really, I cannot tell you how many people I've referred to Dr. Sam, and it's not even just, some people might say, oh, it's just a dentist. He's not just a dentist. He really is a lifestyle, holistic. He really does care about your health, your oral health, but also your physical health, your sleep health. I would refer him to everyone that I could.
When some people have an underbite, your bottom teeth go in front, but mine was different. My my front teeth went behind my back teeth. When I got my mouthpiece, it was pretty scary, but I knew the only thing I was gonna get was the mouthpiece. The second time I got here was what I expected from the first day. been here to get my mouthpiece. Just check, done. That's all it was. If you have a problem, this is the man you want to go see.
Our dentist had sent me for a consult for Tyler for his underbite, and I was originally told by that doctor that I should have him in braces. It seemed a little early to me, so we came to Dr. Sam for a second opinion, and he said, no, we don't need to do braces. I've got just the right thing for you. So we went with this mouth guard, and I've been very pleased. The results that we've seen in 3.5 months that he's been wearing it have been very impressive. They've been great. They're all, so warm and friendly and put Tyler right at ease. He was very nervous when we first came in, and they just settled his nerves, and he doesn't get all frightened anymore when it's time to come and have his checkups. It's been great. I was really worried about an item that he'd be able to take out on his own, thinking that he probably wouldn't leave it in. So we let him take it out that first night, get him comfortable with it over the next 2 or 3 days. And from there, he's left it in all night, every night, and he wears it during the time he's supposed to during the day. And I've actually been very, very impressed with him. He doesn't complain about putting it in. He even reminds me sometimes about, hey Mom, I think it's time to put my mouthpiece in. So I think, he's seen the results and sees how well it's working. So, he's quick to use it. I mean, it's great considering, I was thinking, oh my gosh, here we are going with braces already, and he's 8 years old. And in 3.5 months, his smile has changed so much, just from that look of the bottom teeth being in front, and now his smile just looks so much better. Of course, once he gets his other couple of teeth in that are missing. But other than that, I mean, the smile just looks so much better. And, Dr. Sam was like, sometimes people would think that because he has an underbite, we would need to move the bottom jaw back, but actually in Tyler's situation, the top jaw needed to go forward. So glad that we went with somebody who knew that, and they didn't just, go and try and push the bottom jaw back, which would have kind of changed his whole profile. So thank you, Dr. Sam, for everything you did. Tyler looks great.
I must say, Tyler is very happy with the results, and he has quite the personality. He's a character.
He is a character, and we want to keep that, So fortunately, he's a very, very smart young kid. He's got a lot of enthusiasm. He's highly motivated. We wanted to keep that going, so we didn't want his oral structure to inhibit that issue, and certainly not wish that he would need surgery at a later age. I wouldn't wish that on anyone.
That's right.
So by correcting his jaw position, he's going to breathe better. He's going to sleep better. And the benefits, no orthodontics, no extractions. And one thing they didn't talk about, which I did mention to Mom, I didn't mention it to Tyler, because of his jaw position, it wouldn't have just been braces.
Yes.
He would have needed something called orthodontic surgery, where they actually break your jaw and reposition it.
Oh my goodness.
Yeah. So
he avoided all that.
He avoided that. Yeah.
That's significant.
So I think in the interview, Mom talked about what really inspired her is that everyone else wanted to push his jaw backwards. We didn't do that. We moved his upper jaw forward.
That's right.
So big difference. So he went from this to this. So what they would have done otherwise is left the upper jaw there and pushed this back. That would make his problem worse, and he probably would have, can't predict positively, that he would have been a sleep apneic patient as an adult.
Yes, indeed. And it would have also changed his profile, as Jacqueline, his mom, just said as well. Yeah. Now, as far as the results that you've been seeing in your patients, like Tyler, we just heard from him and his mom, is that pretty much typical of the kind of results your patients see when it comes to their, sleep apnea-related problems or potential problems, like in Tyler's case, the work that you did for him?
Yes. Now, everyone's different. He is what we call a class 3.
Okay. Meaning
lower jaw out farther than the upper jaw. Sort of a Jay Leno look.
Yes, okay? That's right.
So their lower jaw is actually proceeding. So in many cases, it's the other way, where the upper jaw sticks way beyond the lower jaw. We would call that an overbite or overjet.
Okay.
That's what we typically see more of.
Okay.
Or we have something called an open bite, where the teeth don't come together in the front. All those issues can be treated with these appliances if we start them early enough. So here's the other key. We can start this at the age of 2. So
That young.
That young. So what we're taking advantage of is the growth spurt that's going to occur. So when we try to treat this with an adult, we can still treat it, much more difficult.
Yes, takes a lot longer too.
Slower process, takes
Yes.
longer, because we're not getting the growth spurt. So
Yes.
with the children, if we hit those growth spurts, we can, as you heard from Tyler, it corrected in about 3 months.
Yeah, which is very fast.
Yes.
It's a great preventative method, these options that you've told us about here today, to avoid those major problems as we get older, when we're predisposed to having those problems based on our makeup, right?
Yeah. Oh, absolutely.
Yeah.
And what child wouldn't rather wear a mouthpiece than wear braces?
That's right. Big difference.
Yes. So they can relate to that. Like they may have some sports or athlete hero,
Yes.
and they know they wear mouth guards,
Yes.
right? So they see them when they're watching football. Not so much hockey. I think hockey, they should wear them, but
That's right.
I think they're proud that their teeth are knocked out, but that would protect. So they can really relate to these mouthpieces, something they can, may even be wearing them themselves if they're playing sports.
Yes.
So it's an easy, and they're more compliant. As you heard in Tyler's mom, that within a couple nights he was wearing it with no problem.
Yes, indeed. Now, we're literally out of time, Dr. Sam, but I wanted to ask you, before I let you go, you and your practice, the Julian Center for Comprehensive Dentistry here in Columbia, Maryland, certainly established a reputation for excellence. Not only are you one of this region's top dentists, obviously you have great expertise in sleep apnea related issues, and a whole host of other modalities that you specialize in. You're helping so many folks in this community. And you also have a great reputation for patient care, as we just heard from Jacqueline and her son, how you are, and your staff here. But I wanted to ask you what you feel really helps separate you and your practice apart from many of the others.
I'd say primarily, and this is what I hear from patients, is we take our time with our patients and we listen to them. So the most common thing I hear, no one else has listened to me. They're all in a hurry. So we don't double and triple book, meaning we don't schedule more than one patient at a time.
Oh, that's great. They get to have that one-on-one
It's a
with you.
one-on-one reputation, and we build that rapport with the patient, and we have a connection. So they feel like they are being listened to. And in any field, people just want to be listened to.
That's right.
And in the typical medical dental practice, there's too many people coming in and out, and they don't hit the opportunity. How can you really help somebody when you only have 5 minutes with them?
Yes, and doctor, your office here is more like a dental spa. It's not like the dental offices that I remember when I was a child. And so many of us, in fact, have a certain amount of anxiety, stress, even phobias in some cases of going to a dentist. It's one of the, I think it's in the top 3 things that right after death and taxes, right, is going to the dentist that makes people nervous. So with that being said, you really have a very relaxing environment, spa-like environment with the latest in technology. You have a great staff with Gina and the other folks, and not to mention your personality, and your many years of experience and expertise as a top dentist in this area. I love the fact that when patients come to you, they're going to meet you, and that's the whole point I'm making as well, is that when they go to dental practices, and it's already a nerve-wracking experience, so the fact that they get to see the same dentist one-on-one, as opposed to we saw Dr. Sam on this visit, but now I'm nervous again, and I'm coming back and I'm being passed on to somebody else.
Right.
And
or Dr. Sam's gone.
Yes, and in this case, it's you each and every time, who they meet, who they see, and I love the fact that you do that, because that really personalizes and relaxes that experience for each of your patients, not to mention the results they get.
I have to say my team is excellent at that, making everyone feel calm, reducing their anxiety, making them feel like this is a home environment. So my team is excellent at that, and I just want to say thank them for all the work that they do, because I couldn't be this great dentist without them.
Absolutely, it's all of you together.
Yes.
Well, on that note, we'd like to thank you, Dr. Sam, for joining us, educating us, and being a guest on our program. It was a pleasure having you on.
Well, thanks for the opportunity. I appreciate it.
We'd love to have you back on in the future.
Okay, absolutely.